Okay, a neoplasm is a new growth, and it's the word we use to mean cancer. A neoplasm is a tumor. Cancer cells are characterized by uncontrolled growth. They grow too fast and don't stop dividing. They mutate into something that doesn't function properly, and they don't die off as they're supposed to. The suffix "oma" is what we use to stick on the end of something to say that it is cancerous. So it's the tissue and then "oma," sarcoma, carcinoma. The body has a constant number of cells within it, and the body's pretty good about balancing that. They balance cell growth and cell death. Cells die off as new cells are formed so that the total number remains constant. But this doesn't happen in cancer. Cells proliferate and we get a huge number of cells growing that shouldn't be growing. They should be dying off. Viruses may be responsible for some of the development of cancer. Normal functions of the cell usually stop the division of a mutated cell. So the body sees, we just made a mutated cell, it's not normal, let's get rid of it. So in many cases, the progression of cancer, the development of cancer is stopped by the body itself. And this is just when it would have started. I'm not talking about once the cancer is there. I'm talking about once in the very beginning, when those first mutated cells show up. So this doesn't always happen, though. The body doesn't always recognize the mutated cell and stop it. Benign tumors. Remember, tumors are uncontrolled growth, but when they're benign, these tumors may function normally or at a higher than normal rate. They're usually encapsulated, they're encased, they're sealed off from the rest of the body tissues. They don't usually invade the surrounding tissues, but they may damage tissues and organs next to it by compressing it, pushing on them. Malignant tumors are abnormal cells. The organs do not function normally when they are malignant. They grow rapidly and continue to mutate. They are not encapsulated. They don't have those clear edges. They're not walled off. And they can spread to other tissues. That's called metastasis. They also compress and destroy tissues that are nearby. Cancer is manifested by organ failure and organs that don't function normally. And then we have the local effects, most of which are due to compression. An individual who has cancer has pain, abnormal bleeding, edema, and ascites. The tumor is pressing on the lymph tissue or pressing on the blood vessels, so you get the swelling and the fluid collection. There may be hyper or hypotension depending on what blood vessels are being compressed. And with vessel compression comes hypoxia and ischemia. There is also abnormal hormone production, especially ADH, ACTH, and the PTH-related proteins, and these can affect clotting and neurological functions. Then we see cachexia. That's the generalized wasting that comes as cancer gets worse. There's the anemia, weight loss, anorexia, muscle wasting, and generalized weakness.